So I think first, before we start to discuss, I think we have to ask, why do we study? And how do we study, either spouses or families? I think the first lesson I got as a social worker, doing all my studies in the School of Social Work, is like person in the environment, ecological perspective. This is what I got from my studies and through my studies with Zehava, that we always see one person, but he or she as family or community, lovers, that we have to take care and to study and to understand them. So this is the passion I got during my studies as a social worker, and following that when I came to do my PhD with Zehava. And when we study families, so why do we do it? We have the ecological perspective, that's one idea. But I think it's not only that. In some traumas, we see it's not a one-person event. The example you gave, it's an event that occurred specifically to one person, but it's affecting the whole family. And if a person goes to the military and he comes back, and if he was in captivity, it's not one person event. Of course, this person has experienced much more diverse traumatic events. There is no discussion. But the effects of these events, from my perspective at least, have to be seen in a family-oriented perspective. And then we raise many questions about the research, about secondary traumatization, about the theory and about the research. What qualified a study to be a family or couple study? Is it the question, like what Danny was saying? Is it the methodology, whether we asked two persons or not? Isn't the theory we used, if we think as a partner, as a spouse, maybe it's enough to be qualified as a family or couple study? Is it the statistics? I mean, people now use APM. Is it enough to call it a couple study? So I think all of these questions have to be raised in relation when we move from studies on one person to either couples or family studies. When we talk specifically on secondary traumatization, I think we have to raise at least some of these questions and I would go through each of them more elaborate. But first, what is transmitted? So do we talk about any distress that is related? Alana, you see your slide? Any distress that is transmitted? Marital relation, distress, parenting? Or do we talk about specifically PTSD reaction? Do we measure the right? Do we really know that this PTSD related when we talk with the spouse and we ask a questionnaire, is it really related to our partner, male veteran memories, or is it due to our personal experiences? So this is question, and what is transmitted? Is it only negative effects? We have talked a lot about negative. You had some about PTG and post-trauma, and we talked yesterday about empathy, but we have a lot of strengths and power and abilities that might be transmitted. These are only two quotations from study that we did. We interviewed here the spouses, and this is stuff that they told us about what they've learned, what they've gained. So when we talk about families as a one system, we see the effects on them, but remember, we see them as a support resource. We say that they are the major resource for support. So do we measure it, do we use it? And there is some other studies about Australian veterans that see the same about resources. Does that work? Secondary traumatization, who are the other partners in this family? We have a lot of studies about female partners. First, what about male partners? We know much less. Do we know about couples from same sex? Do we know about children? We do have some studies about children, very limited. What do we know about siblings? Living in the same family with one partner or one kid has experienced a trauma. What about the other sibling? What role do they take? We have a study now. One of my students, she interviewed siblings of someone who has PTSD, young adults who have PTSD, and see and discovered and documented the burden they are taking, the responsibility they are taking. We know some stuff about it from studies of grief, the role that kids are getting. What about the siblings? What about parents of young adults? Many of the people who suffer from PTSD are not married or got married or have someone but separated. When we did the study about couples, we got also many angry phone calls because the criteria were you have had to have a partner for at least 6 months. So people told us if we had had a partner for 6 months, we wouldn't have PTSD, we wouldn't be in your study. The reason we are in your study because it's so difficult for us to maintain contact, to have positive contacts. It's really a real story. So we have the partners, but what about parents, especially in the Israeli society? So these are young adults that many times don't have partners or have difficulties in partners. And then the parents are taking many responsibility, informal responsibility. But when they have to go to the rehabilitation office or get some formal, we don't have a place. What about therapists? We have started to talk about this and about the relations. I know that Zahava has a story that when she began to start and learn about families and spouses, and I think you might tell the story in the afternoon, they always tell her, okay, who is next? So I think this is one way to see it. Okay, if we recognize others, we might have to pay to give them legitimation, but I think we as researchers, as part of this society, have to see from a broader perspective and to recognize these needs of these people. So this is the question, to whom? And we raised already the change in the PTSD criteria that qualified the other people in the family as qualified to PTSD, not just to secondary traumatization. So what does this say about all the phenomena of secondary traumatization? Is it really a direct trauma to live with someone? I think we have your article and we have the change in the DSM. Some of us think this is not exactly what we see. We might see more options when we see family members. So that if we give them the classification of PTSD, we might miss some of the complexity of the picture that we have to raise. What about the directions of the effect? So we talk about one direction, now we talk about the direction. We have 3 directions in Professor Zera's study. Do we have only from parents to kids? What about the effects? And we saw yesterday with Ruth Feldman study that there are effects from bottom up, from kids to their parents. So this is more complex kind of. And is it like the same generation is secondary traumatization? And if it's from one generation to the other, it's another term. It's another issue that we have to complicate and understand and learn more. And the last question, is it unique? We have been talking here in relation to trauma, in relation to PTSD. Does living with someone who suffers only from depression, is it the same? Can we see the same issue? Is what we see and what we study and what we talk, how unique it to trauma in general, and we know it's not, and how unique it, or what is the uniqueness of PTSD? This is question because people study secondary traumatization sometimes about the events that one has to think if there are traumatic events, and then how did they assess the second traumatization? It's also raised many questions that we should raised. One of the examples of something that is not necessarily unique to post-trauma is the issue of caregiver burden, that we know that there is literature, and we gain this term, we use this term and this concept from other literature of elderly people and other illness, chronic illness. Is it the same secondary burden? Is it the same spouse burden? Or is it unique to post-trauma? And we don't have, as far as I know, there are very, very limited studies that compare different studies. We compare traumatic brain injury and trauma, but could we compare it to other, like the war trauma, to illness trauma, to chronic trauma, acute trauma, as we talked yesterday? So I think these are some of the questions that we should raise in relation to the discussion of secondary trauma. I just want to say, if when we have this answer, we should talk about the intervention. So if this woman or these parents or these kids or these spouses suffer from post-trauma PTSD, so are these the interventions they should get? Maybe they should get if they suffer from something else. What intervention should they get? Last, we have initiated a family trauma center in Bar-Ilan University, which is a collaboration between many researchers. And our idea is saying there are many, many people that do and study the individuals, and this is necessary. But we have to look broader and to look on the broader picture of the family, and we are trying to advocate to put this lens, to add additional glasses on our head and to see it from a broader perspective. And we offer one conjoint behavioral cognitive therapy that it takes both partners, and it's working on promoting and enhancing marital satisfaction, talking about emotions, about cognitions, and trying to shrink or to fight or to reduce PTSD symptom. It is based about cognitive intervention that was developed in the state by Candice Monson. But we also did this one. We also did with Natal 3 weeks ago a group orientation, a group project, 4 days of a workshop with couples from different ages, experiencing the similar issues and working together, trying to work. So I wanted to raise some of the questions, and we do have some time if people want like to react or ask more questions about the issues of families. Thank you. This is the group. This is my. Okay. Thank you. Thank you.
I have a comment. So, what's I think missing across these, so of course I advocate for core theory, I have for years. They say theories are like toothbrushes, no one wants to use someone else's. So we have all these little models, but there are several theories that encompass these, but instead you come up with the question, well, what about this? Well, what about that? What about this? What about that? There is no scientific advancement from the infinite number of individual findings that you have. I'll repeat that. I'll repeat it. There is no scientific advancement from individual scientific findings that are not organized into greater structures. And what's missing here is even an attempt to try to organize into greater structures and theories that exist, of which there are several, and if you don't like those, come up with another one and test it. Because the testing comes up with specific hypotheses. I always say that the role of every theory is to be rejected. Hopefully not soon, but to be rejected. But there's nothing that can be rejected in any of these studies. If there's nothing that can be rejected, you are not doing the step of science that you need to do. Because science has to be rejectable. You have no findings in any of these of which you say, oh, we're wrong. Up, we're wrong. Wrong about this, we thought it would go this way or that way, but that's not a wrong. We were wrong, our big we're wrongs. And it's really something that has to advance as science. So it's a broad criticism.
Thank you very much for your, like, a little bit provocative comments. I was accused of being blunt, but not that blunt.
Well, these important would feed into many important.
No, but I definitely agree with you, and I think we are working on it. So we do have theoretical papers asking these questions. I don't agree about. I think each question takes us further. It helps us to shape our theory, because there are also some paradoxes that we know from separate studies. For example, about the social support. We know it helps, but sometimes, you know, and you have, and Zahava have written about it, it makes troubles as well. So how do we incorporate? So I think we learn from every study, and there is a need to take all of these studies, and we do have some theory in relation to couples that I did not present, but that couples and families, and about the multiple reaction, based on some assumption and hypothesis that we know from individual theories. So I think we use this and we move forward. But, yeah.
I would also like to relate to what Stephen said. I beg to differ. I think science takes small steps, and these small steps accumulate into theories, and those theories should take into account any evidence that we have. And paradigms and theories are generated according to evidence and not just out of the minds of people that are disconnected from what we have in the field. So I think each and every study is taking a small step forward. It might not be a gigantic step, it might not be a paradigm shift, but it is necessary and crucial in order to make the advancements that we need.
So I would differ. Each study makes no contribution whatsoever unless put back into a larger building block of hypothesis. And again, the key statement of a theory is, I have to do things, there has to be something where I found here to be wrong. That has to be a clear possibility. And there is nothing here where in a grand scale, anything is wrong, because it's putting the money on the table. Theory puts your money on the table. These are the building blocks that could do that, but they don't work unless you do. And I very much think it is related to the toothbrush phenomena. That because then you have to glorify someone else. I think for the work on pregnancy in children, the work of O'Hara, and if you don't and come up with his theories and put them on there, then again it's missing this necessary step of science.
Okay. Thank you. I think it's a further and a bigger discussion about the role of theory, but I do think we have accumulating questions and issues, and we have come wrong many times, every day.
Oh, she does.
We do publish as well.
Yeah, thank you, Stephen. Theory is indeed needed, highly needed. Theory is a sort of a map. It's not the landscape itself. It's something that guides us, and we actually use theories to test them and see whether they're actually valid, if we could either validate them or reject them. And I think what Racheli actually did, which I found, I don't know, I'm biased, of course, you know, but I was fascinated by it, because what she does, she raises the questions, and then you tie them together and say, well, if this is the land that we're about to tour, what kind of a map can we create to actually see whether it could be validated or not? So in any event, I do thank you for this provocative remark, which raises, I mean, we got out of our comfort zone, which is great. And thank you, Racheli, for everything.
Thank you, everyone.